general is suffering from major functional issues. Baby is not able to feed well, baby is not able to breathe. This is a syndrome, it's a very rare congenital syndrome. We're going to place external devices.
Is the only reason this baby is alive.
The patient has micrognathia, that is a severely retruded. So during the surgery, we have done an osteotomy. We have made intentional.
Your kid and you all, because you're very understanding from the beginning,
Sunil sir is not only doctor, surgeon, but he is really a god for our baby. He saved my baby.
Here we are in the oral complex, and this cutie, this baby, is having something called as a Pierre-Robin sequence, and by this is a syndrome. It's a very rare congenital syndrome characterized by a triad. That is, patients have underdeveloped jaw, micrognathia. Their tongue happens to fall backward as glossostosis, and also airway obstruction. These kind of patients are often found to have cleft palate. Similarly with this baby is now 4 months old, and baby has a cleft palate. Baby is not able to breathe, having severe breathing difficulty. You see a tube that is going in. Also, the baby also had a feeding tube. We've taken it out for the surgery in particular. So the baby in general is suffering from major functional issues. Baby is not able to feed well, baby is not able to breathe on his own. So today we are going to perform a mandibular distraction. We're going to do an osteotomy and distract the mandible forward so that his airway improves, overall jaw comes forward, so the baby can look like just another normal child. So this is called a mandibular distraction procedure. We're going to place external devices and going to activate a device after a period of few days, and then once we have achieved the desired amount of advancement, desired distraction, then comes the latency phase. So today we will be performing an osteotomy, then we are going to start our activation, the distraction phase, and finally the latency period, after which the distractors will be removed. So we are going to shift this baby to the OR now, and our anesthesia team will take over thereafter. It's going to be a difficult intubation. Let's proceed. Start our anesthesia. Sleep it.
is Dr. Grace was helping us, Dr. Dhanush helping us, the pulmonologist, he also came, he also helped us, everybody was so wonderful to be with us. Some bleeding, oozing is that, don't be worried, okay? Wipe it away, huh? And your name? Ramani is, because of Ramani is the only reason this baby is alive, huh? You are the only reason. Matt, where is that? No. He's scared and it's okay, father is always scared. She's the only one who's making the baby alive. Okay, I try to stick it as you do it. Okay, if anything wrong, anything you want, you ask. They help you. You are staying with the baby in the room full time. You can go get him food around this room. Okay, tomorrow I think he'll come and twist it. Okay, this is two things are there. Well, twisting, this will come bigger and bigger. So that should pull the tongue friend. That's the total idea. They may take 2 weeks. That's up to you and them. Okay? Anything more? Ramani. And it is, she knows. And they are told everywhere. So thank you for believing in us.
Thank you.
Thank you for believing in us and giving your small baby to us.
Thank you.
Like you, that's okay. But thank you for believing. Okay? We have shunted her so many places she has gone. I'm saying thank you, Ramani, for believing in us.
Yeah.
It's like oh, that's okay. I told her. It's not.
Anyway, we have managed to put the distractors and baby's fine. Right? Now every other day we will turn and this will grow. That's all. Tongue is also out. You can have a bite of the tongue also.
This suture is taken on the tongue. We'll
Tongue.
see whether it makes any help or not. Otherwise, I can take it up to
Yeah.
not you.
We will do.
One of us.
It's fine.
Hungry must be. Okay? So you feed through this. You can. Now if you want to do also you can. You check it, no? How do you check it?
By pulling to
Okay.
or
Okay.
by putting it in some water.
Water, no bubbles should not be there. Okay.
Then turn, it's very easy. You can also see. We will tell you how to, you won't turn, but you will know how to turn. Number will be there on the side.
We'll
You
learn
can see
it.
that, no? 1, 2 is there. So if you turn, 1 becomes 2, when 2 becomes 3, one side is 2, one side is 1 now. And one day you have to turn only one thing. Like morning, again after 12 hours, they will do again. So like that we will do after 48 hours. And it might take 15 days, I told you, no? I think I told you 25 days. Yeah, it will take like that.
No problem. Sadness more sterile, that's all. Bottle is also okay. Okay, bottle water anyway, English bottle water.
Alright, so here we have a patient who is a known case of Pierre-Robin syndrome. So Pierre-Robin syndrome, in short, I will just explain. Patient has micrognathia, that is a severely retruded mandible. It almost as if the patient has no mandible at all. Second thing is something called as glossoptosis, that is the tongue falling backward. And the third thing is airway obstruction, mainly because of the tongue falling backwards, because these patients have a very rudimentary tongue to start with, and once that falls back, patient is not able to breathe. So this baby has had a lot of issues since the child was born. The parents, I must say, they're very brave, and kudos to them for taking such good care. And till the time now, baby is almost 4 months, And what we have done, what Dr. Richardson has done, is a procedure called as distraction osteogenesis. So right now what you see on both sides are distractor devices that we have placed, and daily we rotate this, that is the screw that we are rotating both sides equally on both sides so that the mandible is brought forward. So during the surgery we have done an osteotomy, we have made intentional fracture over the mandible so that both the sides grow apart, grow away in such a way that the mandible is brought forward. Alright, so here we are with the mother of this patient who is been with us for over 10 days now, and I want her to share her experience as to, let's find out as to when she knew that baby has a particular kind of syndrome. When you were pregnant, did you know that baby is syndromic? Any anomaly scan you have done?
No, only TIFA scan in 5th month we have done.
5th month you did a scan. So they said everything's normal.
Everything is normal and he's fine.
He's fine. And then when he was born, what did the doctors tell you?
He has some breathing problem. He cannot able to breathe. They put oxygen over there. After I was shifted to Vizag hospital. There the baby was treated in NICU for 6 days. Only first day he needed some oxygen. After that, while putting this, he can able to breathe.
So they put this immediately after birth?
Yes, ma'am.
Okay.
These tubes are there, esophageal and these tubes, feeding tubes are there from birth.
Okay. And then, so they put the tube, and how often do you change these tubes?
I'll change these tubes for a week, weekly. I'll change.
Weekly, you'll change the tube. Then, how once a week you'll change both the tubes? And if you have any difficulty while changing the tubes?
No.
Baby is fine. Okay. And if you don't put this tube, then baby starts having breathing difficulty.
Yes, ma'am.
Okay. So then, how did you land up here in Richardson? How did you come to know?
Many videos, YouTube videos.
But
Sir,
anything similar to Perry Robin?
Yes, we saw a case in YouTube. Sir solved the case by mandibular distractions. We saw the case, so we came here through a hope.
Okay. And in which month you decided like you want to come?
In July, baby's 2nd month.
2nd month. So in 2nd month you decided, and were you told like a particular weight baby should attain? 5 kilos, right? All right. So so at present baby is 4 months, and we have done a distraction osteogenesis. So that means we've made a cut in the mandible, an osteotomy, and we've already started the distraction. So mandible is coming forward. Do you see any improvement from the surgery day till now? Yeah.
The breathing problem was somewhat cured compared to
It's
before.
better, yes.
It's better.
Baby was just having a lot of heavy breathing,
Heavy breathing
with
and retention
sound.
is there. Chest will go inside, but now it is somewhat better.
All right. So we are going to do this distraction for a week maybe, and as days pass by, you will see even more improvement. Once the mandible comes forward, you have nothing to worry. Okay. The care is good. Okay, as of now, all these tubes might come off slowly. We'll see as the child, as the mandible comes forward, how's the child coping up, and according to that, we'll take a decision for removal of the feeding tube. All right.
So we can't see very clearly, but we still know that everything is fine. All right. Okay, so what I think you need to do is sit down, no? Sit down. So continue the turning to morning to evening for 5 days. Then again send me pictures and videos. Then I'll tell you if we need to do a little bit more or we stop with that. Maybe we can stop with that, we'll see. No discharge should be there, no fluid should be there, no collection should be there, no pus should be there, no fever should be there, no movement should be there. This should not open, this should not be loose, nothing like that. These are the main things that you have to take care. The next thing is, you got to make sure that the baby is active, and if any small thing with infection, something, show pediatrician. We can give you Dr. Sara's number, so at that time we can take care if there's any emergency. But emergency handling, I will find it difficult. Do not get angry if I'm not able to contact you. You might try contacting me. I'm traveling again on the 6th. Till 10th I'm traveling. I'll be busy. I don't know whether my phone is reachable. Try to contact my base here if something we can do. I hope nothing goes wrong. If in case some bleeding is there, something is there, you have to go to a surgeon for an emergency. You can go to that hospital or somebody and tell them what has happened. Something you do like that. If nothing happens, which I think will be the case, after 5 days you wait. Again, I will tell you to turn for 5 days or 3 days. Then we stop. We'll not do too much because it's already come out very well. Let's not be too greedy and do too much, and the risks are more, because we can't do faster than this. We have to do it at this speed. If you do faster, it can cause some other issues. I think 5 days we should be fine. Maybe 3 more days if we want to push little bit more. Okay, then wait for 3 to 4 months. 1 week before you come here, you have to send another scan like this. That scan I check and I'll tell you okay. Sometimes I might say not okay. Then you have to wait for 1 or 2 more months.
Yes, sir.
Then you come. Next time you come, you have to come for only like 1 week maximum, 5 days to 1 week. We do the palate surgery, we remove this. This is the plan. Sometimes if it doesn't go according to plan, we may not do palate. But 99% I will do both. And make sure as he's becoming normal, as he's becoming more mischievous, more active, more alert, he's going to be more bothersome. He'll try to move, push, run. You got to be careful. So continue the same monitoring, that's very, very essential. You let go of that, he goes, hits, he falls, he breaks. Don't allow such things to happen. You have to be careful with that. All right? Your kid and you all, because you're very understanding from the beginning, See, sometimes it's a human relationship that is required. You have to understand what we try to do for you. And you people understood that, even though you don't speak our language and you come from somewhere. But because that happened, I was upset that the first thing didn't get done. We lost 3 or 4 days. No, first was fever. That we can't do anything. Then from my side, we lost 3-4 days because my team wasn't able to get it done in that particular setup, And then anyway, we got it sorted finally, even though there was a delay, everything went off. Well, I'm very glad about that. And it's a real joy to see him, because when he first came, oh my God, it was like really sad. And I was told by surgeons and doctors not to do surgery for you. Here, I will tell you this also. Okay, I told them, don't tell me. 2-3 doctors told me in that hospital which you went, the pediatric surgeon and another surgeon and the father all told me, don't do the surgery. It's very risky for the child's life. So we want to take risk. I said, no, the surgery is needed. Whether you want to take risk, we will decide. But we are experienced, we are trained. So this is where it is difficult for us also, because everybody has to go as a team. Willing people together, when we work, then miracles happen. Alright, so you take care. I'll see you maybe in January or February. Okay?
I was delivered in Vijayanagaram on April 22nd, 2022, blessed with a baby boy. After his birth, he was suffered with breathing problem. We their doctors asked us to admit in a big hospital in Vishakhapatnam. So the baby immediately taken to big hospital, and there he was treated in NICU for 6 days. After that, thereafter we shifted to some other hospital, and I was treated by the hospital management to look after the baby, how to feed the baby, how to take care of the baby. I was trained there for 20 days. After that, I was discharged to our native place. Then after I look after the baby for 4 months. Then after we see the videos of Richardson Hospital, many videos we observed and followed the videos regularly. So we came over here to make the child better by PRS. Sir already did many surgeries. We saw the surgeries in YouTube. So we came here with a hope that our baby will get a good life. After that, the baby was observed by Sunil sir. He explained us how risk the position of the baby is and how critical the surgery will be going on. He did mandibular distractions are placed over the jaw, and there is a tongue reverse for this baby, and the tongue is also taken front and stitched by him. On this September, the surgery is completed. Now it is being 20 days. We observe many differences before and after surgery. Before surgery, there is no chin, and the breathing problem is very frequent. But now we observe many changes, and now breathing problem is not there frequently, and the chin also grown up, and the feeding, I was giving feeding through pipe. Later 5 more days there is no need of pipe. We observe many changes, many differences before and after surgery. I hope sir did the best job in that changes our life. Sunil sir is not only doctor, surgeon, but he is really a god for our baby. He saved my baby. Thank you.